Hi dear friends, welcome to Medical Destiny YouTube channel. Before watching this video, please take a moment to subscribe my channel. In this video, you will go through 25 NCLEX RN nursing examination multiple choice questions and answers. Read the question by yourself and find the correct answer. Let's begin.
231. The nurse is caring for a client diagnosed with pneumonia. The nurse plans which of the following is the best time to take the client for a short walk? 1. After the client eats lunch. 2. After the client has a brief nap. 3. After the client uses the metered dose inhaler. 4. After recording oxygen saturation on the bedside flow sheet. Answer: 3. Rationale: the nurse should schedule activities for the client with pneumonia after the client has received respiratory treatments or medications. After the administration of bronchodilators, often administered by metered dose inhaler, the client has the best oxygen exchange possible and would tolerate the activity best. Still, the nurse implements activity cautiously, so as not to increase the client's dyspnea. The client would become fatigued after eating, therefore this is not a good time to ambulate the client. Although the client may be rested somewhat after a nap, from the options provided this is not the best time to ambulate. Option 4 is unrelated to the client's ability to tolerate ambulation. 232. A nurse inserts an indwelling Foley catheter into the bladder of a postoperative client who has not voided for 8 hours and has a distended bladder. After the tubing is secured and the collection bag is hung on the bed frame, the nurse notices that 900 milliliters of urine has drained into the collection bag. The appropriate nursing action for the safety of the client is to: 1. Check the specific gravity of the urine. 2. Clamp the tubing for 30 minutes and then release. 3. Provide suprapubic pressure to maintain a steady flow of urine. 4. Raise the collection bag high enough to slow the rate of drainage. Answer: 2. Rationale: rapid emptying of a large volume of urine may cause engorgement of pelvic blood vessels and hypovolemic shock. Clamping the tubing for 30 minutes allows for equilibration to prevent complications. Option 1 is an assessment and would not affect the flow of urine or prevent possible hypovolemic shock. Option 3 would increase the flow of urine, which could lead to hypovolemic shock. Option 4 could cause backflow of urine. Infection is likely to develop if urine is allowed to flow back into the bladder. 233. The nurse has a prescription to administer amphotericin B, fungicide, intravenously to the client with histoplasmosis. The nurse plans to do which of the following during administration of the medication? 1. Monitor for hypothermia. 2. Monitor for an excessive urine output. 3. Administer a concurrent fluid challenge. 4. Assess the intravenous. 4. Infusion site. Answer: 4. Rationale: amphotericin B is an antifungal medication and is a toxic medication, which can produce symptoms during administration such as chills, fever, hyperthermia, headache, vomiting, and impaired renal function, decreased urine output. The medication is also very irritating to the foresight, commonly causing thrombophlebitis. The nurse administering this medication monitors for these complications. Administering a concurrent fluid challenge is not necessary. 234. A client who experiences repeated pleural effusions from inoperable lung cancer is to undergo pleurodesis. The nurse plans to assist with which of the following after the physician injects the sclerosing agent through the chest tube? 1. Ambulate the client. 2. Clamp the chest tube. 3. Ask the client to cough and deep breathe. 4. Ask the client to remain in one position only. Answer: 2. Rationale: after injection of the sclerosing agent, the chest tube is clamped to prevent the agent from draining back out of the pleural space. Depending on physician preference, a repositioning schedule is used to disperse the substance. Ambulation, coughing, and deep breathing have no specific purpose in the immediate period after injection. 235. A client with a posterior wall bladder injury has had surgical repair and placement of a suprapubic catheter. The nurse plans to do which of the following to prevent complications with the use of this catheter? 1. Monitor urine output every shift. 2. Measure specific gravity once a shift. 3. Encourage a high intake of oral fluids. 4. Prevent kinking of the catheter tubing. Answer: 4. Rationale: a complication after surgical repair of the bladder is disruption of sutures caused by tension on them from urine buildup. The nurse prevents this from happening by ensuring that the catheter is able to drain freely. This involves basic catheter care, including keeping the tubing free from kinks, keeping the tubing below the level of the bladder, and monitoring the flow of urine frequently. Monitoring urine output every shift is insufficient to detect decreased flow from catheter kinking. Measurement of urine-specific gravity and a high oral fluid intake do not prevent complications of bladder surgery. 236. A client with benign prostatic hyperplasia undergoes transurethral resection of the prostate, TURP. The nurse requests which of the following solutions from the pharmacy so is available postoperatively for continuous bladder irrigation, CBI? 1. Sterile water. 2. Sterile normal saline. 3. Sterile Dakin's solution. 4. Sterile water with 5% dextrose. Answer: 2. Rationale: continuous bladder irrigation is done after TURP using sterile normal saline, which is isotonic. Sterile water is not used because the solution could be absorbed systemically, precipitating hemolysis and possibly renal failure. Dakin's solution contains hypochlorite and is used only for wound irrigation in selected circumstances. Solutions containing dextrose are not introduced into the bladder. 237. A client with acquired immunodeficiency syndrome, AIDS, is being admitted to the hospital for treatment of pneumocystis jirovecii infection. Which of the following activities does the nurse plan to include in the care of this client that assists in maintaining comfort? 1. Monitor vital signs. 2. Evaluate arterial blood gas results. 3. Keep the head of the bed elevated. 4. Assess respiratory rate, rhythm, depth, and breath sounds. Answer: 3. Rationale: clients with respiratory difficulties are often more comfortable with the head of the bed elevated. Options 1, 2, and 4 are appropriate measures to evaluate respiratory function and avoid complications. Option 3 is the only choice that addresses planning for client comfort. 238. A client with significant flail chest has arterial blood gases, ABGs, that reveal a PaO2 of 68 and a PaCO2 of 51. 2 hours ago the PaO2 was 82 and the PaCO2 was 44. Based on these changes, the nurse obtains which of the following items? 1. Intubation tray. 2. Chest tube insertion set. 3. Portable chest X-ray machine. 4. Injectable lidocaine, xylocaine. Answer: 1. Rationale: flail chest occurs from a blunt trauma to the chest. The loose segment from the chest wall becomes paradoxical to the expansion and contraction of the rest of the chest wall. The client with flail chest has painful, rapid, shallow respirations while experiencing severe dyspnea. The effort of breathing and the paradoxical chest movement have the net effect of producing hypoxia and hypercapnia. The client develops respiratory failure and requires intubation and mechanical ventilation, usually with positive and expiratory pressure, PEEP. Therefore an intubation tray is necessary. 239. A client with empyema is to have a thaw ratientesis performed at the bedside. The nurse plans to have which of the following available in the event the procedure is not effective? 1. Code cart. 2. A small bore needle. 3. Extra large drainage bottle. 4. Chest tube and drainage system. Answer: 4. Rationale: empyema is the collection of pus within the pleural cavity. If the exudate is too thick for drainage via thaw ratientesis, The client may require placement of a chest tube to adequately drain the purulent effusion. A small bore needle would not effectively allow exudate to drain. Options 1 and 3 are also unnecessary. 240. A nurse is preparing to administer an opioid to a client via an epidural catheter. Before administering the medication, the nurse aspirates and obtains 5 milliliters of clear fluid. The nurse takes which action? 1. Injects the opioid slowly. 2. Notifies the anesthesiologist. 3. Flushes the catheter with 6 milliliters of sterile water before injecting the opioid. 4. Injects the aspirate, 6 milliliters of clear fluid, back into the catheter and administers the opioid. Answer: 2. Rationale: aspiration of clear fluid of less than 1 milliliter is indicative of epidural catheter placement. More than 1 milliliter of clear fluid or bloody return means that the catheter may be in the subarachnoid space or vessel. Therefore the nurse would not inject the medication and would notify the anesthesiologist. Options 1, 3, and 4 are incorrect actions. 241. A nurse is planning care for a client with a chest tube attached to a Pleurovac drainage system. The nurse includes which interventions in the plan? Select all that apply. 1. Clamping the chest tube intermittently. 2. Changing the client's position frequently. 3. Maintaining the collection chamber below the client's waist. 4. Adding water to the suction control chamber as it evaporates. 5. Taping the connection between the chest tube and the drainage system. Answer: 2, 3, 4, 5. Rationale: to prevent a tension pneumotrax, the nurse avoids clamping the chest tube, unless specifically prescribed. In many facilities, clamping of the chest tube is contraindicated by agency policy. Changing the client's position frequently is necessary to promote drainage and ventilation. Maintaining the system below waist level is indicated to prevent fluid from re-entering the pleural space. Adding water to the suction control chamber is an appropriate nursing action and is done as needed to maintain the full suction level prescribed. Taping the connection between the chest tube and system is also indicated to prevent accidental disconnection. 242. A nurse is assisting a client with a chest tube to get out of bed, and the chest tubing accidentally gets caught in the bed rail and disconnects. While trying to re-establish the connection, the Pleurovac drainage system falls over and cracks. The nurse takes which immediate action? 1. Calls the physician. 2. Clamps the chest tube. 3. Applies a petrolatum gauze over the end of the chest tube. 4. Immerses the chest tube in a bottle of sterile normal saline. Answer: 4. Rationale: if a chest tube accidentally disconnects from the tubing of the drainage apparatus, the nurse should first re-establish an underwater seal to prevent tension pneumotrax and mediastinal shift. This can be accomplished by reconnecting the chest tube, or in this case, immersing the end of the chest tube in a bottle of sterile normal saline or water. The physician should be notified after taking corrective action. If the physician is called first, tension pneumotrax has time to develop. Clamping the chest tube could also cause tension pneumotrax. A petrolatum gauze would be applied to the skin over the chest tube insertion site if the entire chest tube was accidentally removed from the chest. 243. A nurse is caring for a client with a diagnosis of Cushing's syndrome. The nurse plans which of these measures to prevent complications from this medical condition? 1. Monitoring glucose levels. 2. Encouraging daily jogging. 3. Monitoring epinephrine levels. 4. Encouraging visits from friends. Answer: 1. Rationale: Cushing's syndrome is a metabolic disorder resulting from the chronic and excessive production of cortisol by the adrenal cortex or the administration of glucocorticoids in large doses for several weeks or longer. In the client with Cushing's syndrome, increased levels of glucocorticoids can result in hyperglycemia and signs and symptoms of diabetes mellitus. Epinephrine levels are not affected. Clients experience activity intolerance related to muscle weakness and fatigue, therefore option 2 is incorrect. Visitors should be limited because of the client's impaired immune response. 244. A client with a central venous catheter who is receiving parenteral nutrition, PN, suddenly becomes short of breath, complains of chest pain, and is tachycardic, pale, and anxious. The nurse, suspecting an air embolism, places the client in lateral Trendelenburg position on the left side and 1. Monitors vital signs every 30 minutes. 2. Clamps the catheter and notifies the physician. 3. Slows the rate of the PN after checking the lines for air. 4. Boluses the client with 500 ml normal saline to break up the air embolus. Answer. 2. Rationale. If the client experiences air embolus, the client is placed in the lateral Trendelenburg position on the left side to trap the air in the right atrium. The nurse should also clamp the catheter and notify the physician. A fluid bolus would cause the air embolus to travel. Vital signs are monitored continuously. 245. The nurse is caring for a client who is 33 weeks pregnant and has premature rupture of the membranes, PROM. Which of the following would the nurse expect to be part of the care plan? Select all that apply. 1. Perform frequent biophysical profiles. 2. Monitor for elevated serum creatinine. 3. Monitor for manifestations of infection. 4. Teach the client how to count fetal movements. 5. Use strict sterile technique for vaginal examinations. 6. Inform the client about the need for tocolytic therapy. Answer. 1, 3, 4, 5. Rationale. PROM is membrane rupture before 37 weeks of gestation. Whenever PROM is suspected, strict sterile technique should be used in any vaginal examination to prevent infection. Frequent biophysical profiles are performed to determine fetal health status and estimate amniotic fluid volume. Monitoring for signs of infection is a major part of the nursing care. The woman should also be taught how to count fetal movements daily, because slowing of fetal movement has been shown to be a precursor to severe fetal compromise. Elevated serum creatinine does not occur in PROM but may be noted in severe preeclampsia. Tocolytic therapy is used for women in preterm labor, not for PROM. 246. A nurse is monitoring the laboratory results for the client who has been diagnosed with carbon monoxide poisoning and is asking for the oxygen mask to be removed. The nurse determines that the oxygen may be safely removed once the carboxyhemoglobin level decreases to less than 1.5%, 2 10%, 3 15%, 4 25%. Answer. 1. Rationale. Oxygen may be removed safely from the client with carbon monoxide poisoning once carboxyhemoglobin levels are less than 5%. Options 2, 3, and 4 are elevated levels. 247. A nurse is teaching a pregnant client about nutrition. The nurse includes which information in the client's teaching plan? 1. All mothers are at high risk for nutritional deficiencies. 2. Calcium intake is not necessary until the third trimester. 3. Iron supplements are not necessary unless the mother has iron deficiency anemia. 4. The nutritional status of the mother significantly influences fetal growth and development. Answer. 4. Rationale. Poor nutrition during pregnancy can negatively influence fetal growth and development. Although pregnancy poses some nutritional risk for the mother, not all clients are at high risk. Calcium intake is critical during the third trimester but must be increased from the onset of pregnancy. Intake of dietary iron is insufficient for the majority of pregnant women, and iron supplements are routinely prescribed. 248. A client is admitted to the hospital with a diagnosis of acute bacterial pericarditis, and the nurse prepares to perform an assessment on the client. Which of the following findings are associated with this inflammatory heart disease? Select all that apply. 1. Fever. 2 leukopenia, 3 bradycardia, 4 pericardial friction rub, 5 decreased erythrocyte sedimentation rate, 6 severe precordial chest pain that intensifies when in the supine position. Answer: 1, 4, 6. Rationale: in acute bacterial pericarditis, the membranes surrounding the heart become inflamed and rub against each other, producing the classic pericardial friction rub. The client complains of severe precordial chest pain that intensifies when lying supine and decreases in a sitting position. The pain also intensifies when the client breathes deeply. Fever typically occurs and is accompanied by leukocytosis and an elevated erythrocyte sedimentation rate. Malaise, myalgias, and tachycardia are common. 249. A client is admitted to the hospital with a diagnosis of Cushing's syndrome. The nurse monitors the client for which of the following that is likely to occur in this client? 1. Hypovolemia. 2. Hypoglycemia. 3. Mood disturbances. 4. Deficient fluid volume. Answer: 3. Rationale: Cushing's syndrome is a metabolic disorder resulting from the chronic and excessive production of cortisol. When Cushing's syndrome develops, the normal function of the glucocorticoids becomes exaggerated and the classic picture of the syndrome emerges. This exaggerated physiological action can cause mood disturbances, including memory loss, poor concentration and cognition, euphoria, and depression. It can also cause persistent hyperglycemia along with sodium and water retention, hypernatremia, producing edema, hypervolemia, fluid volume excess, and hypertension. 250. A physician is performing indirect visualization of the larynx on a client to assess the function of the vocal cords. The nurse tells the client to do which of the following during the procedure? 1. Try to swallow. 2. Hold the breath. 3. Breathe normally. 4. Roll the tongue to the back of the mouth. Answer: 3. Rationale: indirect laryngoscopy is done to assess the function of the vocal cords or obtain tissue for biopsy. Observations are made during rest and phonation by using the laryngeal mirror, head mirror, and light source. The client is placed in an upright position to facilitate passage of the laryngeal mirror into the mouth and is instructed to breathe normally. The tongue cannot be moved back because it would occlude the airway. Swallowing cannot be done with the mirror in place. The procedure takes longer than the time the client would be able to hold the breath, and this action is ineffective, anyway. 251. The nurse is caring for a client scheduled for a bilateral adrenalectomy for treatment of an adrenal tumor that is producing excessive aldosterone, primary hyperaldosteronism. The nurse appropriately tells the client which of the following? 1. You will need to wear an abdominal binder after surgery. 2. You will most likely need to undergo chemotherapy after surgery. 3. You will not require any special long-term treatment after surgery. 4. You will need to take hormone replacements for the rest of your life. Answer: 4. Rationale: the major cause of primary hyperaldosteronism is an aldosterone-secreting tumor called an aldosteronoma. Surgery is the treatment of choice. Clients undergoing a bilateral adrenalectomy require permanent replacement of adrenal hormones. Options 1, 2, and 3 are inaccurate. 252. The nurse is caring for a client who is scheduled for an adrenalectomy. The nurse plans to administer which medication in the preoperative period to prevent a dyspnea crisis? 1. Prednisone orally. 2. Fludrocortisone, Florinef, subcutaneously. 3. Spironolactone, Aldactone, intramuscularly. 4. Methylprednisolone sodium succinate, Solumedrol, intravenously. Answer: 4. Rationale: a glucocorticoid preparation will be administered intravenously or intramuscularly in the immediate preoperative period to a client scheduled for an adrenalectomy. Methylprednisolone sodium succinate protects the client from developing acute adrenal insufficiency, a dyspnea crisis, that can occur as a result of the adrenalectomy. Prednisone is an oral corticosteroid. Fludrocortisone is a mineralocorticoid. Aldactone is a potassium-sparing diuretic. 253. The nurse is preparing a client with Graves' disease to receive radioactive iodine therapy. The nurse tells the client which of the following about the therapy? 1. After the initial dose, subsequent treatments must continue lifelong. 2. The radioactive iodine is designed to destroy the entire thyroid gland with just one dose. 3. It takes 6 to 8 weeks after treatment to experience relief from the symptoms of the disease. 4. The high levels of radioactivity prohibit contact with family for 4 weeks after initial treatment. Answer. 3. Rationale. Graves' disease is also known as toxic diffuse goiter and is characterized by a hyperthyroid state resulting from hypersecretion of thyroid hormones. After treatment with radioactive iodine therapy, a decrease in the thyroid hormone level should be noted, which helps alleviate symptoms. Relief of symptoms does not occur until 6 to 8 weeks after initial treatment. This form of therapy is not designed to destroy the entire gland. Rather, some of the cells that synthesize thyroid hormone will be destroyed by the local radiation. The nurse must reassure the client and family that unless the dosage is extremely high, clients are not required to observe radiation precautions. The rationale for this is that the radioactivity quickly dissipates. Occasionally, a client may require a second or third dose, but treatments are not lifelong. 254. A client arrives at the emergency department with upper gastrointestinal (GI) bleeding and is in moderate distress. The priority nursing action is to 1. Obtain vital signs. 2. Ask the client about the precipitating events. 3. Complete an abdominal physical assessment. 4. Insert an esogastric tube and hematisthemesis. Answer. 1. Rationale. The priority action for the client with GI bleeding is to obtain vital signs to determine whether the client is in shock from blood loss and obtain a baseline by which to monitor the progress of treatment. The client may not be able to provide subjective data until the immediate physical needs are met. A complete abdominal physical assessment must be performed but is not the priority. Insertion of an ANG tube may be prescribed but is not the priority action. 255. A client with acute renal failure is prescribed to be on a fluid restriction of 1,500 milliliters per day. The nurse best plans to assist the client with maintaining the restriction by 1. Removing the water pitcher from the bedside. 2. Using mouthwash with alcohol for mouth care. 3. Prohibiting beverages with sugar to minimize thirst. 4. Asking the client to calculate the 4 fluids into the total daily allotment. Answer. 1. Rationale. The nurse can help the client maintain fluid restriction through a variety of means. One way is to provide frequent mouth care. However, alcohol-based products should be avoided because they are drying to mucous membranes. The use of ice chips and lip ointments is another intervention that may be helpful to the client on fluid restriction. Beverages that the client enjoys are provided and are not restricted based on sugar content. The client is not asked to keep track of 4 fluid intake. This is the nurse's responsibility. The water pitcher should be removed from the bedside to aid in compliance.